The Dental Download Podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Okay, hi everyone. So we have another guest here today, and I'm going to let them introduce themselves.
How's it going, everybody? My name is Dr. Avi. I am an associate dentist down here in Austin, Texas. Currently, I am transitioning out of a DSO practice as an associate, and I'm going to be working at a private office also as an associate.
Nice.
And I'm super excited to share my story and talk with you guys today.
Yeah, thank you for being here. I'm excited too. Do you, I guess, can you give us a little bit more background? Like, when did you graduate dental school? How long have you been at this first job?
Yeah, so I went to UCF for undergrad. So that's in Orlando, Florida. And I graduated in 2014, went to NYU for dental school, graduated in 2018. And when I came out, I didn't do a GPR and no residency, nothing like that. I just went straight to work. So I started working in Connecticut as an associate. And I was actually in between a lot of offices my first couple of years out. I worked in like 10 offices my first 2 years. And then we can kind of dive into that a little bit later if you want. And then moved to Austin in September 2020. And then that's where I had this current job, basically working for a mini DSO. And now that's where I'm transitioning into a private office.
Oh, so you've had a lot of different experiences. Do you want to just talk right now about right after graduation, those different offices you worked in? Was it like a mix of part-time at a few places or just struggling to find the right fit? How did that work?
Yeah, definitely both of those. So good advice, I would say, is coming out, it's a good idea to work a couple part-time gigs, just because any new job that you get as an associate, you have to basically try it out. It sucks because everybody wants something stable. Dentistry obviously is a career that a lot of us chose because of the stability, but it takes a while for that to really kick in. So yeah, I was usually in 2 offices at a time, just working like 2 or 3 days. And, it's expected to a certain degree from owners for associates to do that. Some may want you full time, but I think just it's smart to protect your time and energy by not doing that. Because I made that mistake. There's a couple offices where I gave them essentially, 5 days a week and a Saturday even. And it ended up just not really working out for various reasons. Some offices, they may not be busy enough for you, may not be good fits. There's just a bunch of things that can happen. So you can kind of negate a lot of that if you only work a couple of days a week, because then you can see, what's good, what's bad, and then you have something to compare it to.
Did you find a lot of these offices that are hiring for part-time, are they just looking for an associate and they were willing to do part-time like a few days a week? Or was it like they frequently have part-time people come in and that's just how they run things? Do you get what I'm asking? I'm just curious.
Oh yeah. So up in Connecticut, so like in the Northeast, like being in the Northeast and also now seeing what it's like in Texas, it's very different. So up there, it was normal for offices to be looking for part-time dentists because it's usually, like a private owner. Usually, if it's private, they're looking for part-time. Any like corporate setting or like bigger groups, they're looking for full-time. And that is just there's a there's a couple different reasons why they do that. I think the private offices, they don't necessarily know, if they're ready for an associate. So they're also trying to kind of hedge the opportunity there by not having an associate come in and then not having a busy schedule being full time. Um, the only office that I had experience at where there was like a part time situation was he basically called it like a Saturday position and like wanted me to work like multiple Saturdays a month. Um, And at that time, I mean, I was pretty desperate, so I was gonna like take whatever, but I did tell him that, hey, I really only want to be working like one Saturday. So we ended up reaching kind of a middle ground there. But it's not something that you'll see where they're always hiring part time. Usually it's like part time and then they want to grow it into full time. But in my experience, that doesn't really happen just because all their ducks aren't necessarily in a row. So yeah.
Yeah. And now that you're moving from this like small DSO into a private practice model, what was the reason for that change? And like, what about this new job did you like?
So a couple different things went into it. So this DSO, when I joined, it was just like 5 offices, so it wasn't that big. So it was awesome because I got all the benefits that come with the DSO, like health insurance, full staff, scheduling, all that kind of stuff. They had an Itero, they had CE that they were willing to like pay for like $2,500 a year. So it was all those benefits and perks. And then they got acquired in the summer of last year. So it's been about like 8 months. And during that transition process, that's when things started to go south, meaning a lot of that quality control on like the business side of things and kind of how the manager would run the office. There was just a lot of changes and they weren't really staying on top of it because we went from essentially 5 offices to like 40. That's where that dilution kind of happens. And so, schedules weren't being monitored. Myself and the other dentists were starting to have to take over a lot of like the non-clinical stuff, like making sure this other rest of the staff was doing their job. So it just started to become overwhelming, and a lot more than we essentially were kind of being asked to do. And honestly, it was just that was kind of one part of it, and then a couple other things kind of played out where I wanted to kind of have a more formal role with Invisalign in the company, just because I had a lot of success with it. So I wanted to just teach the other doctors in the group and just be like an internal support resource for them. And so I wanted like a more formal role. And so I kind of pitched that to the leaders of the group, and they thought that there was value in it, but I guess just in their timeline of growth, they just didn't have that space. So that was kind of like a long-term reason why I was willing to stay with the DSO. And then so you have those 2 reasons. And then the third reason was this opportunity at the private office kind of came up, and I've known the owner previously, and he was like, hey, I'm looking, I'd really want you to come help like grow the practice. And essentially kind of like giving me the reins to do whatever I wanted. So it was like 3 things that literally all happened within like 48 hours. And then I spent the weekend just talking about it with my wife. And what came of it then was accepting that job and then starting my consulting business kind of on the side, where instead of just helping one group, I can kind of help any doctor implement Invisalign in their practices.
That's super cool. When did you officially start the consulting?
So that started a couple months. So it's been about 2 months now. Yeah, 2 months. I mean, essentially having to build like a small business from the ground up. That's the experience that I've gotten. I guess there's some similarities to what dentists do when they build their own practice. Obviously not nearly as much of a startup cost. This is more kind of just the knowledge that I've gained over the years, and I've learned how to build a website and make videos and stuff like that, and just kind of using my network with different reps to try to market to other dentists out there doing speaking events and stuff. So it's been fun. But yeah, it's like a little side gig, and hopefully that kind of blossoms. But I'm also super excited about the clinical opportunity that I have too.
Yeah, for the Invisalign, I know we had like a speaker come talk to our Academy of General Dentistry from Invisalign, and they were saying that if we start classes like third or fourth year of dental school, we could be Invisalign certified like pretty much right when we graduate. I don't know if you have
Mm,
familiarity with like how students can try to be certified like as soon as possible near
yeah,
graduation.
yeah. So NYU, I think had something like that, except for it was like mandatory. So at NYU, it was like one of our classes, like the Invisalign class. So we all came out certified to do Invisalign. I recommend it. I mean, I'll be honest, you probably aren't going to like learn the way they teach it, and the way you do it in the real world is totally different. My experience, at least at NYU, was like super complicated. Yeah, I mean, it's like a lot of modules and stuff, but the value is like you are certified. And if you don't get certified in school, you have to pay, I think it's like $3,000 to get certified when you come out. So, I mean, if your school's offering it, I 100% do it. And then just know that when you get out, you'll just have to kind of utilize some other resources out there to get comfortable with it.
That makes sense. I also want to talk a little bit more about your new dentist right out of dental school experience, and then we can kind of backtrack to dental
Yeah.
school itself. But is there anything that sticks out for like when you graduated, just things that didn't go how you expected them to?
Yeah. That's basically like my entire story. So I came out wanting to like go the whole like cosmetic route. I was like, yes, like cosmetic dentistry, like this is what I want to do. I mean, being at NYU, you kind of see like Dr. Appa like doing his thing, and like there's a huge presence of that there. And it's super inspiring. I thought it's like really, really cool. So in my mind, that's what I had envisioned. And like older dentists had kind of like not shot it down, but it's like, oh, like the real world is different and all that. And I was like, oh, like why does it have to be different? Like why can't we just, why can't I do it? But the real world happened, and like I said earlier, about 10 associateships later, I realized like, okay, doing veneers and stuff like that is a little challenging when you can't even keep a job for 3 months. So um, yeah, I'd say I envisioned it kind of going that route. I always knew that I wanted to to do I wanted to like do something more than just like your routine dentistry, I guess. I just didn't know what that looked like. So it wasn't cosmetics. And then I mean, as of now, I've kind of found my passion with Invisalign. Um, but I think another thing that I had expectations that didn't happen was a mentor. Like I thought I would come out and like find a mentor, work with them, have like this dentist teach me stuff, and then like, you know, get tips and whatnot. But like that didn't happen. And I mean, just even talking to some of my other like friends and stuff, that doesn't really happen. So I know everyone coming in like in school like is hopeful for that. But it's just weird. It's like you graduate and then everyone just is kind of like on their own. Um, so, I personally got like a lot of just real world experience. And it was nothing like I had imagined. But yeah.
Is there anything you did over these past couple of years that you felt like helped yourself adjust to all those struggles or get through them and like persevere?
Yeah. I think just like, I mean, honestly, just like staying positive, like keeping a positive mindset, like being hopeful really helps. That's just the type of person I am in my core. And I mean, there were definitely times where like I started to have a negative outlook on dentistry. I mean, I was burnt out of it. I'd say probably like maybe a year and a half in. 2 years in, like very quickly. It was just a lot. I started to kind of question my abilities. Like, I couldn't keep a job. So I'm like, am I even a good dentist? It's like stuff like the doubt started to creep in. Um, I mean, I have my wife to thank. She would always kind of just like keep my head up, and just keep kind of pushing on. But, staying the course in that regard, and just kind of trusting and knowing that, like, even if you go through a lot of hardships when you come out, like it's not you, right? Like the hardest part, in my opinion, is like getting through dental school. Dental school is super hard. It really puts you under a lot of pressure, a lot of stress. And so if you graduate, you pass your exams and stuff, like you're going to be successful. It's just a matter of kind of finding out what works for you. Um, but yeah, I'd say just you gotta stay positive, and don't like, another thing for me was like kind of like where my mental health would get affected was on Instagram. Like I'd see all these successful dentists like doing all these like gorgeous cases. Um, and here I was like, in like a Medicaid office, like doing these like fillings and extractions, and they were good at the time, but then it's also kind of like I would just naturally like compare myself to them. And so that wouldn't help because I would start to feel even like worse about what I was doing. So yeah, I'd say don't compare yourself, because your situation is going to be very different compared to what you see on Instagram, for a lot of other dentists out there.
Yeah, I definitely appreciate you saying that. I think I was talking to someone else earlier today for another podcast episode, and they were kind of saying the same thing. Like they literally had to like mute accounts on Instagram of like classmates and stuff. Like they're happy for their success, but like seeing it every day just sometimes isn't the
It's
best for the mental headspace.
it's hard. It's hard. Like, I mean, that's like one of the like, so it's actually funny. Like now I start sharing more on my Instagram, but I mean, there was a point not too long ago where I wasn't following any dental accounts. Like every dental account, I just unfollowed them because I was like, I can't do this. Like, I don't want to see any of this. I just want to like do my own thing. And it was good. It was good. And now it's like, I mean, I do follow dental accounts now, but I had to do the mental work, right? Like, I mean, I started going to therapy for not just this, like other reasons as well, just to kind of get my headspace, in a better place. And yeah, and I had to kind of work on myself before that, because I realized, yeah, like I was like being jealous or like hating on people for no reason, and like, being super critical of myself when it's just, there's no reason to do that. But yeah, it's tough on Instagram.
Yes, definitely. And I think I always try to like be, especially with school, like you're constantly having good moments and bad moments. So I try to be like very transparent about like the good and the bad, but it's a lot easier when I'm saying like, oh, I did bad on like a lecture test than like to come on there when it's a real patient and be like, oh, like I screwed up. Like that's a whole nother level to like put that on the internet. So I understand why there's never
Hmm.
like cases gone wrong so much like publicly put out there, but it's important, like you said, to know your boundaries and just like differentiate like work and the rest of your life, because I mean there's more to life than dentistry is what I always try to remind people.
Facts. That is
Yeah.
100%. So that's like the core of why I started sharing on Instagram more, is like, hey, there is a whole world, and like there's so many other things in my life that bring me joy outside of clinical dentistry. And that's, I wanted to be like my account, like I kind of made it to show that to other dentists and other like students, like, hey, it's like, I mean, you can go look at my page, like I don't even think there's a single picture of any teeth on there, like at all. And it's just because it's like, it's, you don't like, the whole page doesn't have to be that, right? Like there's so much more that goes into it. Don't get me wrong, like I love what I do, but it's it's just, I don't know, I feel like if there was a page like mine when I was in dental school, I feel like it would have been like, yeah, like that's nice to know that, you know you don't have to pump out like high end cosmetic work to really still love what you do, and be happy with what you do. So yeah, don't fall into that trap.
Yeah, I definitely agree with you there. Is there anything looking back, I guess, talking about like reflecting when you were a dental student, is there anything that you wish you maybe did differently while you were in dental school?
Um, yeah, I think, and I didn't figure it out until like the end of dental school, but I know for like a situation like yours, like, D3, about to be in clinic, I would say one is like, especially in clinic, like you are going to get out of it whatever you put in. Like it's the one time in your life you don't have any liability, meaning like anything that you can do, like go for it. Like extractions, like try them all. Root canals, go for it. Like you got to remember, like the faculty is there to help, but they're only going to help the people that want it, right? Like I kind of cruised through clinic the first year, and then in the second year I got my requirements and I kind of like got out. Like there was one rotation that we had. It was an oral surgery rotation where it was super cool. We got to go off site, and it was just basically like six of us. Everyone partnered up, and we'd go once a week, and we just get to do extractions in this clinic, and it was awesome because there's just one oral surgeon like watching over all of us. So me and my buddy got to just like pull teeth like all day, and it was so much fun because we figured it out, right? I mean, we had basic techniques, but we got to dive in and do it. Um, and then that kind of spilled into my clinical mindset. But that's what I would say is like I wouldn't be afraid. I was also like I didn't want to like I wasn't a gunner by any means. Like I think it just had like a super negative connotation at NYU. But looking back, like there's nothing wrong with it. Like we all paid like, oh, we're paying a lot of money to go to school. Like you should get the most out of it. Again, there were people in our class that would like do stuff just like for themselves and be super selfish, which is not cool. But I mean, if you're doing it to like improve your situation and learn the most, like go for it. That was something that held me back. Like I was always like afraid of being looked at as like someone like trying to be like an overachiever. So then I just thought it was cool to coast, which was, I mean, I was pretty young. I got into dental school at 21. So, um, you know, a lot of our class, I think the average age when we started was like 24. So everyone else was like a little bit more mature. So maybe that was my own like insecurities coming out. Um, but yeah, like just go for it. Like try things. Don't hold back. Any like D1 or D2s that are listening, I would say, you know, don't be too hard on yourself with grades. I kind of found my flow like with studying where I realized like, hey, I could put in like so many hours. I think it hit me pretty early on, which I'm grateful for this, is like I studied so hard, and then I think I got like a 92 on the anatomy exam, or like 91. And I was just like, okay, not bad, but I was like, I really felt like I should have gotten a higher grade. And like the next exam, I studied a little bit less, and I got like, like a B plus, and then the next exam even less, and I got a B. And then I just figured out like, hey, like I'm a B student, like in terms of where, how much studying I have to put in to learn the material and what I'm going to get out. And then that just helped me have like this whole like school life balance where I didn't have to like drown myself in the books, and I could still get a good grade and pass and then move on. Obviously, you don't know if you're going to specialize or not when you first start. So I'm not saying like bomb all your exams, but like, I mean, if you know you don't want to specialize, then like it's okay if you're not getting like the best grades. Just do what you can, get to clinic, and then maximize in clinic.
Yeah, I totally agree. And they always like share like the averages on the exams and stuff too. And I'm like, what? We don't need to know that. Like, it's like I'm in that situation where I know I want to be a general dentist, and
Hmm.
I just like genuinely try to take these classes and just think like, how is this going to apply to patients? Like, how much can I try to remember from this one lecture? Like, I'm really just trying to learn the most. And it's similar to what you were saying. Like, I don't get A's and everything, and that's okay.
It's literally the last time your grades mattered was undergrad. I mean, because the thing is like, even if you're going to specialize, from what I know, it's like they don't just look at your grades. Like you have to pass that exam, and then like interview. Like there's multiple steps, and if you don't get in on the first try, like people do a GPR and then they go specialize. So it's like that whole mindset is different. You need to do what you can to, like you said, learn the most how it's going to apply to being a general dentist, or being, a clinician after, and just soak up that information because that's what's important.
Definitely hear what you're saying there. I have a couple more things I wanted to talk about before we wrap up. First being, you said you've worked in DSOs, you're going transitioning into private. What from like your experience or maybe like your classmates, colleagues is like the major difference that you've noticed between private and corporate offices?
So they both have good and bad. I've had good and bad experiences in both, and they both have their benefits. So it just depends on your situation, honestly, and what you want out of it. Um, Corporate is great to just kind of like get your feet wet, get practice, get your reps in, because you're always going to have volume. You're not going to have to worry about a busy schedule or not. Corporate always has that. You also are going to have, like I was saying earlier, your benefits like health insurance. They'll pay for malpractice. They'll give you a CE stipend. So that's awesome, in my opinion, for younger dentists. Um, it gets a little bit tricky because some of these DSOs are going to be super focused on like you producing, right, and just focused on your production numbers and all that. But from my experience, like numbers aren't always a bad thing. Because I mean, I'm a goal oriented person, so it's kind of nice to know a production number, in my opinion, because it helps you like have a predictable income, right? Like, I'm not saying I do stuff that's not needed, but like, it's nice to know, like, hey, like, this is what my paycheck is going to look like. Because as a dentist, like, you only get paid, what you produce. That's just how it works. So if you have like a very slow month, like, you're, you know, you're going to have to budget accordingly. So again, it all depends on the DSO and how their philosophies are, but that's something to kind of be aware of. Um, what's another thing? Oh yeah, so for private, for private, it's good and it's bad. I haven't had the best experiences with it so far. I was in one good situation where the doctor like actually did give me a lot of like helpful tips. Um, but then I didn't realize until afterwards that he was like withholding procedures from me. Like I would diagnose like bigger cases like crowns and stuff, and then he would just like they would end up on his schedule and not mine. So that was kind of crappy. But yeah, the value in that was like I just, I learned a lot of like pointers. So early on, that was enough for me. But yeah, now I kind of also know the type of dentist that I am, being 4 years out, and I know what I want, and so this opportunity is awesome because I can actually go in and I'm not trying to figure out who I am. Like I know what to do. When you're first coming out, like that's the thing. Like you're still learning the type of dentist that you are. So I mean, there were situations that probably the private office was a good opportunity. I just didn't make the most of it because I wasn't ready for that situation.
Yeah, that makes a lot of sense. And there's, like you said, like any type of any office can just be so different. It just depends on like who you're working with there and how they choose to
Hmm.
run things. So I think it's good for people, like you said, to kind of try out some different things and see what works for them.
Yeah.
So I also wanted to chat a little bit about we were talking about your Instagram page and your videos, your consulting. So what like aspect of this like education are you most passionate about and who are you kind of trying to reach with this page?
Yeah. So I think like with the YouTube page and even Instagram, it's a lot of just kind of giving back. Um, you know, the who I'm trying to reach is a little bit of a mix, but it is definitely targeted more towards the younger dentists. For me, it's kind of therapeutic, honestly, to just like give advice to younger dentists because that's something that I always looked for and never really found. So it's just kind of cool that like I was talking to one of my friends. So he's a year younger than me. So in dental school, I was kind of like his mentor, and then we both were working in Connecticut. So we would always like vent to each other about like good days and bad days, and we both were kind of getting this like carousel of jobs. Um, and then he actually kind of told me the other week, he was just like, "Hey man, like you're becoming that guy that like you always wanted, in terms of just like sharing, tips and stuff like that." So I was like, "Oh wow, that's pretty cool." But yeah, that to me, it genuinely makes me happy. I like giving advice like that, especially to people that want it. Um, I also enjoy talking about, clear liners and Invisalign, and just kind of helping kind of get exposure through social media. It changed the way that I practice. Like I said earlier, like I was burnt out on dentistry. I didn't really know what I liked or what I wanted. And then once I started doing more cases, I saw like, I felt like I was actually making a difference for my patients, right? Like, you improve someone's smile, you improve their oral health, you move teeth around, stuff like that. Like to me, I was like, wow, like I'm actually doing something. Um, so that's something that I like to also share. Um, but yeah, target audience, yeah, like I was saying, it's going to be your students, younger dentists, just people looking for some inspiration. I'm enjoying life right now, and I like sharing that. And sometimes, it's nice to have a little boost on your feed.
Yeah, that's great. Like you said, like we were saying, like everyone needs that little positivity, a little like light at the end of the tunnel if they're kind of struggling, that things turn around if you keep pushing through.
Absolutely.
When you were just talking, it made me think of something related to like patient communication that I always kind of ponder about. So when you're like treatment planning with someone that comes in and they have all these different things going on with their mouth, but they're the type of I want straight white teeth, but they might have gingivitis and caries and all these things. Like, how do
Hmm.
you go about that communication with them that like we have to address certain things first, or like how do you like to treatment plan complex, I guess, or just patients that have a lot of dental needs?
Yeah. So when they have a lot of stuff, so that is always like, so there's some like, and you'll see, not every practice has that. Like some offices, that is going to be like every single day you see it, and then others you see it every once in a while. So you kind of lose that muscle. But what I like to do is I like to just kind of like set the stage, and then just try to like educate them, right? Because if they have all these problems, most likely they haven't been to a dentist in a while. So showing them that you're looking to prioritize their oral health first, and then focusing on the appearance, um, helps them kind of comprehend and understand. Like, yes, like I want your teeth to be straight and white as well, but we get there first by making sure that they're healthy. Because if we straighten them and whiten them, but they're not actually healthy, well, then you're at a higher risk of losing them, right? So, again, it doesn't hurt to get dramatic with patients. Sometimes they need that, a little bit of like, you can lose your teeth. And then we're talking about, different, more expensive treatment. But that's what I like to do. If you can educate them and be kind of concise and direct, they tend to respond really well to it, because then you come across more confident, and then they trust you. And then it's more of like, okay, doc, like we'll do whatever, like just, let's get there. So that's an easy way, and you'll learn that with time. I think my tip to younger dentists also is like, because I used to do this all the time, is I would just keep talking in the hygiene exam room, and it's like you kind of just have to like stay concise, but like put forward like one option that you're going to kind of do, and then you can kind of talk about the whole big picture afterwards. Otherwise, you'll lose them. They'll kind of forget, um, or they'll just get overwhelmed, and they'll just be like, "Oh my god, that sounds like so much work." And it is, but that's why you're there, and you're there to help them out.
Thank you for that. Yeah, I want to obviously be the best like caregiver that I can and be good at communicating so I can help people, but I like to hear people's perspectives and experience, especially since you've been working for a little while now. So I appreciate
Yeah, no,
that.
that was a good question.
So, last thing, you already kind of gave a lot of great advice for dental students, but do you have any like closing thoughts for the people listening?
Um, yeah, I guess I kind of said the two big things that I usually tell people is like make the most of your experience. Don't worry about what other people think. I think also dentistry is a great profession. So I know there's a lot of chatter out there about like the student loans and like life of a dentist. Like, yes, like it is a hard life, to a certain degree. Like it's stressful, but it's also rewarding. And you know, just kind of stick through it. Don't be afraid to think outside of the box. We once you graduate and you have that degree, like you have a lot of different options and opportunities in terms of what you can do with it. And and just know that like you don't need to like fit in a box. Like you don't need to just be like a run of the mill dentist. Put your spin on it, because I'm learning and I'm seeing in other dentists now that there isn't just one way to do it. And that's what's super, super cool.
Yeah, that's great. I totally agree with that too. I feel like for me, I don't know 100% like where things will take me, but I feel like I definitely will have some added element beyond just clinical dentistry. So we'll see where things go in a few years, but I got to get through school first, like you were saying.
Yes. Yep.
So, what if people don't know your Instagram page? Do you want to just shout it out and best way for people to contact you?
Yeah. So Instagram page is dr.avi. So it's doctor spelled out. Um, my email is dr.avi.dds@gmail.com. And then my YouTube channel also is Dr. Avi spelled out.
Perfect. Sweet. Well, thank you so much for today. I really appreciate all your insight. It was really cool getting to kind of walk through your timeline with you and see how you ended up here and that you're happy and starting on more of a journey of things that you're passionate about. So that's really great.
Yeah. Thanks for having me.
Yeah, of course.
Appreciate it.